So this is the first collaboration between the Emirates Society of Emergency Medicine with the International Federation of Emergency Medicine, which is the biggest organization for emergency medicine internationally. We thought of working on and focusing on an important topic to the UAE specifically, which is trauma. Because it's the second leading cause of a death in the Emirate, and all health authorities in the country are focusing on to decreasing the burden of this disease. The program in general has different tracks, trying to focus with the different stakeholders and the providers, from pre-hospital care providers to hospital care, to surgeons, emergency doctors, nurses, to different aspects. So we tailor different talks to different healthcare providers. For the lecture I gave on the development of a trauma system in the Emirate of Abu Dhabi, and this is we're very proud to launch and announce this program. It's actually one of the early, if not the first, in the region. It talks about more of a comprehensive approach to deal with trauma, all the way from injury prevention to pre-hospital care, to the developing and improving the hospital care for injured patients, and then to rehabilitate them, and above all keeping a database for all of this, so at least we know what we're dealing with.
Hi, my name is Dr. Rasha Bouhameid. I'm the chair of the organizing committee for the Ifem Trauma Update Symposium, which is held here in Abu Dhabi on the 5th and 6th of June 2015 in Sofitel Hotel. And basically it is a trauma symposium, which is a conference that is held based on the International Federation of Emergency Medicine. And it basically brings in the paramedic system as well as emergency and trauma surgeons together to discuss updates in the fields of trauma. And there are so many interesting topics. You will see a variety of healthcare providers here. There are paramedics, there are nurses, there are doctors, surgeons, as well as emergency. And so all specialties are coming together to discuss trauma system in the UAE and how to promote it and improve it.
Hi, I'm Jim Holloman. I'm the current president of the International Federation for Emergency Medicine, and I'm one of the invited speakers here at the International Federation Trauma Update Symposium. This symposium is organized and presented by the Emirates Society of Emergency Medicine, which is one of the component societies in the International Federation. And I'm most happy to be here. This has been so far a most excellent conference, and I think is highlighting the progress that's been made in developing a trauma system here in Abu Dhabi. I think the development work on the trauma system here will be a model for the other Emirates and something that can also be copied by some of the other countries in the region. And there's been very good progress in developing a trauma system in Abu Dhabi.
I'm Fergal Hickey. I'm a consultant in emergency medicine in Sligo in Ireland, and I'm chairperson of Ifem CPD committee. And I'm delighted to be here as part of the Ifem Trauma Symposium. It's been a very fascinating meeting so far, very enjoyable, lots of very good speakers, and lots of people from the region and beyond. And it's been an excellent meeting. I'm talking about trauma fluid resuscitation. So at the moment, as you know, we use a variety of fluids in resuscitation of the trauma victim. And I'm going to give the current evidence on what the best fluid to use is, how much of it we should use, and ideally that we should be using blood rather than other types of fluid.